Characterizing your depression can help to predict your journey to defeat the depression. How severe is your depression? How likely are you to respond to treatments? So how aggressive do you need to be? Do you need to take medications? Do you need to get counseling? So we're going to talk a little bit about factors that predict that you are somebody that needs to look into being very assertive, getting right away into multiple ways of treatment, because we know with depression always gets treated better, more quickly, when you're doing multimodal treatment. So maybe something for the mind like counseling, something for the body like exercise, something for the spirit like a gratitude journal. So what predicts that you're going to have a rough time with depression? What predicts that you might need to have multiple treatments, including, things that you do for yourself, things that others do for you, and maybe medication? One is problems at work. Do you have problems at work? Problems with poor performance? Problems with missing work or being late to work, having excuses for not doing well at work? Are you feeling unorganized? The workplace is a good place to start when you're evaluating how your functioning is, how much the depression's had an impact on your daily function. What kind of problems do you have with interpersonal relationships? How about your significant other? Are you having some strife with them? How about your household, not just your significant other? Kids, grandparents, whoever you might live with or live close to, are you having difficulties in your communication or your relationships with those people? How about at work? Are you having any difficulties getting along with your coworkers? Any difficulty communicating with your boss or satisfying your boss's desire to get certain things accomplished or to understand what you're doing, where you're coming from, how you're working? How about friends and neighbors? Are you having difficulties with friends and neighbors? How about problems with self-esteem? Are you hypercritical of yourself? Are you finding that you can't accomplish personal or professional goals? Are you feeling worthless? If you are noticing changes in all of these areas, then you need to think to yourself, well, I've got some depression that's impacting multiple areas of my life. Here are some risk factors. These are risk factors that predict that it's going to be a little harder for you to kick your depression symptoms. And we'll talk a little bit about what that means for you. Having a longer duration of symptoms. So the longer you are with your depression symptoms before you seek treatment, the harder it is to get a response. The older you are, actually, unfortunately, the older you are, the longer your course to defeat depression is likely to be. That predicts that you're going to be a little bit harder to respond. Are you having problems with your activities of daily living in medicine? That is a group of activities that we recognize people need to be able to do to function, to be socially acceptable. So if you are having trouble with any of these things, that is a predictor that you have severe depression and need to get some help quickly and probably in multiple different arenas of your life. For example, if you're having problems with bathing, showering, dressing normally, eating in a healthy way, and also in just getting around. Are you finding that you're having difficulty where you're slow moving around? Do you have any suicidal thoughts or homicidal thoughts? Wondering why you're alive, wondering how you could end your life, wondering if your life is worth living, and you have, especially if you have specific thoughts or plans on how to end your life, that predicts that you have severe depression. Actually, in truth, if you have any thoughts of harming yourself or others, we generally recommend that you go straight to the emergency room. That is a serious condition, especially if there are specific plans, and we can get help. Inpatient care can get people feeling better faster because those doctors can give medications more aggressively. If you have a history of having taken medications for depression in the past, and you had a hard time with tolerating those medications, then you're going to be at a higher risk for being difficult to treat for your depression. There are a few personality traits that are related to difficulty responding to the usual treatments for depression. Neuroticism, being anxious about what other people think about you. Negative emotionality, that means you're somebody that is critical, and you've kind of lost your ability to be compassionate with other people. You're critical with other people. Introversion as opposed to extroversion. We all know what that means. Somebody who's very withdrawn is somebody more likely to have problems kicking their depression. People who are very, very very, very conscientious and disciplined, believe it or not, tend to have a little bit more of a hard time emerging from depression sometimes. So those are all things that predict people who will have a little bit more difficult time kicking their depression. I think it's not surprising that if you have other psychological issues, anxiety disorders, OCD, drug dependence, alcohol dependence, if you have ADHD, you're on medications for that, or PTSD, post-traumatic disorder, those are all people that are more likely to be refractory or resistant to the usual treatments. So that's another set of symptoms you need to look at. We've already talked about physical conditions that can affect depression, that can make depression worse. Diabetes, cardiovascular disease, arthritis, kidney disease, HIV, lupus. These are all things that affect your body and can increase your risk for having difficult depression. I think it goes without saying that things like Parkinson's, stroke victims, Alzheimer patients are also at high risk for depression because those are diseases of the brain. So, as we say, the longer you've had your symptoms, risk factors that you might have, there are predictors that you're somebody that may take a while to respond. You may take medication, you may need medication, you may need 2 medications, you may not respond to traditional medications. You definitely need some help, probably with some counseling, and also some ideas about how to integrate activities that are healthy for your brain and your body and your spirit to help kick that depression. And if you notice that you have a lot of factors in your life influenced by your depression, then get on it. Get yourself in to see your provider to assess yourself for chronic illnesses. Get yourself in with therapy. Consider medications, and talk with your doctor or nurse practitioner, PA. Talk with that person or your counselor, actually, about things that you can do in your life with your diet, etc., to help decrease your depression symptoms and help you to defeat depression.